All right. Welcome to the Bacon, Bibles, and Barbells Podcast. I am Coach Justin. I'm joined by Coach Bill and Coach Amanda. We are here today to talk about beta blockers. There are tons of advertisements going around the internet. I've been hit with them, and I'm sure pretty much everybody listening has. Probably all three of us have, I imagine. A lot of companies talking about, and they advertise it as anti-anxiety medication and things like that. Beta blockers have been around forever. They're one of the oldest blood pressure medications, and they do work. So we'd just like to talk about the implications of using them, what the pros and cons can be, and also compare and contrast them with other medications that might be used for similar purposes, whether we're talking specifically about anti-anxiety and blood pressure management. So, Bill, I think it'd be good if you maybe spent the first little bit here kind of talking about how they work, what they're doing on a biological level, and like what the mechanism of action here is.
Yeah, absolutely. So in the body, we have something called beta adrenergic receptors that essentially uptake these beta G-bound proteins. And the idea is that they control sort of constriction, if that's sort of the easiest way to put it. Vasoconstriction. You have the relaxation of smooth muscle, which also produces like arteroconstriction. And so they work in a few different ways, but essentially what they are is they're any of your sort of epinephrine or adrenaline compounds that you have in the body. They're the uptake receptors for those. And so, if you are having an adrenaline moment or a noradrenaline or norepinephrine moment, you're going to have increased sympathetic responses, so increased heart rate, increased blood pressure, increased vasoconstriction, all those kinds of things. Smooth muscle relaxation, which, when you have a sympathetic response, that's why you get stomach aches and you feel like you have to go to the bathroom, things like that. So they're sort of opposing effects, but it's designed to put you in a sympathetic state.
Is this why my dog poops when she's scared sometimes?
True. That's really true. So beta receptors, right, work with three sort of beta G-bound proteins. And so you have beta 1s, beta 2s, and beta 3s. Beta 3s are not really in sight here. They're pretty specialized. Beta 1s, and that's actually beta 3s, just so folks know, that's a good thing. When you're cutting, beta 3s is what you want. That's your lipolysis beta adrenergic compound. And so you want that because that's your fat burning compound. Okay. Mm-hmm. And so the idea behind a bunch of fat burning supplements, right, is that they're creating these sort of sympathetic responses in you in hopes that some of the beta 3 action will happen there and burn a little fat as your metabolism increases. That's its function. So you don't want to target those. But people do want to potentially target beta 1s and beta 2s. Specifically, beta 1s are your increase in heart rate, sort of sympathetic response. So those things that increase heart rate, they make you tighten up a little bit. You get that heat flush kind of deal. And so beta 1s and beta 2s actually have sort of an opposing function. Okay. Mm-hmm. Beta 1s cause additional heart rate increase and vasodilation in that regard. And so you'll get face flushed and all that kind of stuff. And beta 2s help to control that vasodilation by reconstricting your vascular system and helping regulate that through that sympathetic response, so you don't just like pass out. And so what we're talking about is we have selective beta blockers, right? That's one thing that's in view here. And that's usually used for something like heart failure or heart issues or arrhythmia control, mm-hmm. or any of those things, electrical misfires in the heart. And those are pretty hyper-specific medically. It would be really rare for somebody to sort of recreationally or for the sake of anxiety or anything like that, use a beta 1 blocker. These are things for legitimate blood pressure and heart problems that are sort of being treated in a medical sense. And so beta 2 blockers are non-selective beta blockers, and they call them beta 2s, but they actually also block beta 1s. They block both. And so they pass sort of this blood-brain barrier where they can affect some different parts of the sympathetic response in the brain. And so this is commonly what's used for the anxiolytic effect, and probably the one that you see most often advertised. And so you're thinking like propranolol or a medication similar, right? You might have like timolol or nadolol, depending on what part of the world you're in. But that's going to essentially stop the uptake of epinephrine and norepinephrine. in those receptors, it's literally going to block it. It's going to block it. So it binds to that epinephrine and norepinephrine, and then it blocks the reception and the uptake of them. So you cannot get into that sympathetic response. You're not going to get into that sort of panic state, as we call it, or the state of what people typically experience as hyperventilation, or that sort of
fight or flight.
Fight or flight sort of uptick in the physiological processes of the body and the metabolic processes of the body. So that's sort of the short of it. But that's sort of the medical uses in general. The ones that most likely you're going to see, like I said, are the ones that are non-selective beta blockers. And oftentimes they're used as an anxiolytic, but they do control blood pressure. And there are several side effects because you are blocking beta 2s. And so something to think about with beta blockers, especially as it relates to fitness and athletic endeavors. There are several things to consider along the way, but that's sort of the basic science of it.
Yeah. And if I'm not mistaken, like propranolol, I forget how to pronounce it properly, but anyway, that is a beta 2 receptor target, but it crosses the blood-brain barrier. Are there not some medications, beta blockers specifically, of course, that target the beta 2 receptors, which means they hit beta 1 as well? You can't have one or the other. If it's beta 2, it's also beta 1. If I'm not mistaken, don't some of those not tend to cross the blood-brain barrier, or at least less prolifically?
Yeah, correct. So something like a metoprolol, or even telmisartan, something in that vein, that's like almost like an ACE inhibitor. These function in a similar way, and they still do cause beta adrenergic non-reception and uptake, but they don't cross that blood-brain barrier. And so again, that's why like a beta 1 blocker specifically, or something that doesn't cross that blood-brain barrier based on its compounding, is going to be used more in a medical sense, like you've got a serious vascular problem or you've got a really serious heart problem.
Yeah, usually acutely too, like someone that just had a heart attack or something along those lines in the hospital. It's not often prescribed for like regular chronic use.
And it would be unethical to do so, because if you did not have some of those issues, it could create them. It can create things like heart arrhythmias, and it can create pseudo heart failure in people that don't have it, and some things like that. So
cool. All right, so let's talk through the potential pros and cons here of using it for. It's most commonly prescribed for blood pressure use, obviously. And we'll talk about the potential for even like performance enhancement for certain types of individuals. Honestly, generally not for sport, for any of the endeavors that we're into. But so we want people to kind of understand that aspect of it. Secondarily, let's primarily start with just what's going to happen when you're on this stuff. How are you going to feel? How's it going to affect you? What's it doing physiologically? If you're on a normal beta 2 receptor based beta blocker, what's going to happen? I get on it, and what should I avoid? What should I be careful of?
Yeah, once you start, your VO2 max is going to drop. Your perceived exertion is going to be much higher. Yeah. So that's something to be aware of when you're training. I mean, you can already see how those two things alone make it maybe not ideal for an athlete. So you're going to want to have your adrenaline going. If you're competing, you're going to want that response. That's something that's necessary. Yes, I know it causes jitters and nervousness, but it's also something that you need to have whenever you're competing. You kind of need that adrenaline response. So if you're fatiguing faster, if you're recovering slower, you can already see how strength or hypertrophy will be affected by that. So you're just not going to get as far. I mean, maybe the only sports that I could see it really benefiting are things like Olympic shooting, archery, things that you have to like be very still and calculated for.
Yeah, curling.
But even then, that being said, curling, right? That being said, they're banned by the Olympic Committee. So you can't even the sports that maybe it would be beneficial in, you're not even allowed to do so. So they have been used for bodybuilders to have a little bit less anxiety, a little less shakiness or jitters when they're on stage. However, it's going to affect how the muscles can be pumped. It's going to be very hard. It's going to decrease vascularity, which is going to dock you points. So Learning how to control that anxiety with perhaps breathing, breath work, visualizing, stuff like that may be a better fit than doing this and then risking your entire look on stage just because you didn't want to be nervous.
Yeah, and I wouldn't even just say your look too. You might pass out because when you're on stage, typically blood pressure is low because you're dehydrated. You don't have any fat. Like there's all the things that are usually present that kind of assist vasoconstriction are not present at the moment. And then you're going to do something else that blocks your body from introducing its own vasoconstriction to keep you going. Yep. So it could be even a situation where you exert yourself on stage, because it is a lot of people don't realize that a posing routine, like to complete a posing routine, you actually have to have good cardio. You'll be out of breath. Like anyone like that's ever tried it or seen or talked to someone that's done so, it's it's work. You're not just standing there.
I think
it's
you're
hard to
cutting out a little bit.
Oh, sorry.
Okay.
Is that better now? Yeah. So anyone that's done this, they would be able to tell you, like, if you're not in shape for it, you're going to have a hard time. And this will actually make that even more difficult because delivery is going to be somewhat restricted.
Amanda mentioned the perceived exertion going up. You actually have the risk of having a rebound effect if you're in a really, really high intensity athletic endeavor. When your perceived effort goes up, you tend to try harder to make up for whatever it feels like you're lacking. And so you actually can put yourself into a further sympathetic response, which is a really bad rebound to happen in the middle of that, especially if you have some kind of chemical assistance keeping you from being in that state. When you reach it, it's going to be a problem if you're medicated in that way.
Yeah. Yeah. And for the purpose of, strength sports and things like that, even contact sports where you need arousal and things like that, it's going to block arousal. It's even been scientifically demonstrated that yelling right before, just yelling, not necessarily yelling anything in particular, but yelling right before a heavy lift can increase your strength because you're in a heightened state of arousal. You get that little bit of adrenaline and that sympathetic response going. So but specifically, I think we talked earlier, for strongman, what are the potential implications of someone on a beta blocker and safety risk and things like that?
Yeah, I mean, first of all, let's just say you don't have any other risk that's happening. What is happening is your CNS arousal, like you said, is going to be blunted. You are going to have colder extremities. Your circulation's just not going to be as good, which is really necessary to stay warm and be able to perform. You may have muscle weakness, fatigue much earlier, or miss the warning signs that you've gone too far. It's going to be limiting your oxygen. I mean, those things are just necessary to have a good lift. So that's just, the blunting effects of having a beta blocker. Now, the actual real safety risks are you can blow arteries and blood vessels because it's just too weak. There's not any vasoconstriction. So that's a huge risk. Very high risk of passing out, which is incredibly dangerous if you've got something overhead. It's dangerous anyway, but especially if you have something overhead, you're in a really difficult spot. Strongman competitions don't typically have the kind of spotters that you have in a powerlifting meet. So you're really putting yourself in a dangerous place there with that risk of passing out and causing even more injury by dropping something on yourself or falling on an implement that is just not safe to fall on. So these are one of those things that I just wouldn't recommend pretty much ever for a strongman or a strength athlete. Now, if it is medically necessary, then there has to be some ways to work around that rather than, really focusing on RIR, RPE in training, really being able to understand your actual perceived exertion under this kind of medication, not the false perceived exertion that you may get from these, but really understanding what it would feel like before it's just too much. Without actually going to too much. That's an important thing to do. Emphasizing a lot longer rest, emphasizing things like box breathing for calming the system down. So, and if there is a blood pressure issue, that is being dealt with, working on some lifestyle factors so we can kind of get weaned off of these beta blockers would be ideal.
Yeah.
Yeah.
And if you're going to be on something, I would say there's probably just other drugs that would be better as far as blood pressure medication, ARB, even an ACE inhibitor, maybe. If you're someone that's been prescribed a beta blocker, which is going to be usually the ones that end in OL. If it ends in OL, it's probably a beta blocker. And you've been prescribed and you're an athlete, you have any kind of like anything, contact sports, strength sports, anything like that. Also including martial arts as well. I would recommend talk to your doctor about a different class of medication, because it's introducing some real risks to you, to your safety, and it's going to reduce your performance in a way that other medications may not. Bill, did you add something?
Yeah, I was just going to say, if there's a serious enough vascular issue or any kind of peripheral vascular disease, of course, it may be time to just hang up the sport, or do it recreationally, right? Professional competition or even high-level amateur competition may not be right for you if you have certain limitations physically. And so what you don't want to do is over-medicate just so that you can participate in the competition, because, there are real risks to that. So,
that's how a lot of elite athletes really end their careers, is they want to push a little bit harder to do one more thing. I can't remember which athlete it was. It was a UFC fighter I was listening to an interview with, who basically, this doesn't have to do with beta blockers, but this shows what elite athletes will do to be able to fight again in the sports like that. He memorized the eye chart so he could pass the vision evaluation. And
oh man,
just about died in that next fight. So it's a real risk. There's a certain mindset that elite athletes carry, and it's very hard to tell them no. So it's a really hard thing to say, you're done, time to get out while you're on top, but it's very necessary for the safety and longevity of that person.
Yeah.
Or maybe go down a weight class too. That's always an option.
Not just the performance itself, but the extra weight that you have to carry for something like strongman too is probably counterproductive. If you've got any serious conditions happening there vascularly, probably want to drop some weight at that point.
Yeah, and I think this is particular to strongmen and powerlifters, because we tend to put on, and honestly, a lot of people put on weight that's not necessarily helpful. Particularly in strongman, honestly, for pure performance purposes, you can't be too fat in powerlifting, basically.
Yeah. Strongman, I think, Mitch Hooper's a great example. He's outweighed by probably about 100 pounds, 150 pounds by most of his bigger opponents. That's not a small amount, and he just outlifts them constantly.
Yeah, he is a freak though too. So but for most people, I mean, putting on weight is going to, including fat, is going to make you statically stronger, particularly in powerlifting, except for maybe the deadlift. The deadlift may suffer potentially for that. But that doesn't mean that it's worth risking your life. So if you're at a point where you've been prescribed a medication because you haven't been able to manage your blood pressure via normal hydration, electrolyte management, and things like that, or just more cardio, then it's probably time to lose weight. And typically, this is going to encroach on you the older you get. The older you become, the harder it is for your body to manage blood pressure correctly. And the way to typically deal with this, that's pretty surefire, is to be smaller, to get leaner. Muscle mass doesn't usually seem to cause this. It's typically, just body fat. And so it is worth considering, is this worth it? Is this worth chopping a few years off my life? Because the other thing too is these drugs do have consequences. I remember there was a large meta-analysis I read a while ago about blood pressure medication in general. And along with, by the way, type 2 diabetes medications like metformin, it doesn't actually extend your life typically. And if it does, it's a very, very minute amount. It may help the quality of your life, and it might give you a more predictable end, if you will, but they don't tend to actually significantly increase your lifespan, just because, and this is why the American Heart Association even says, don't, as a guideline to doctors, don't even bother prescribing blood pressure medication until someone has had multiple readings over 140, over 80, because trying to get down to that ideal range where you're like, like 120 over 70 or 120, one teens over 60s. Although even I'd start saying like that could be a little bit low for some people. But even so, like trying to go from 130 to 120, don't use drugs for that, because you're introducing risk that's undue, because it doesn't seem to really significantly reduce lifespan to be, say, 130 or whatever, but certainly not to the point that drugs are the answer. Lifestyle is generally going to be the answer. So let's transition here a little bit to, unless you guys have anything to add along those lines, let's transition to the anti-anxiety side of things that a lot of people are using this for. So like certain sports, like we mentioned before, that require a lot of concentration, but not a lot of necessarily athleticism, golf, shooting sports, archery. We were joking earlier about curling, stuff like that. That, you want to actually just calm nerves as much as possible. That can kind of make sense. A lot of musicians, by the way, use them, especially
stage performance. Yeah.
Yes. Yeah, very much so. Just because it's, if you want your hands to not shake, if you're a violin player, you want to be able to have focus and not be distracted by an increased heart rate and things like that. So what are these doing exactly? Kind of revisit what we talked about earlier. And then again, for someone like that, what should their safety considerations be? Because obviously we're not worried about a violin player passing out on stage necessarily. But all of us should be training to some degree. So what cares should be taken for someone like that that's using it for this purpose, even if it's in an acute manner?
Yeah. So even if it's used acutely like that, you want to make sure of a couple things. So beta 2 blockers, specifically non-selective beta blockers, right? You really want to make sure that you have a good handle on things like liver numbers, things like kidney filtration, things like blood sugar and blood glucose, insulin responses, any kind of vascular disease that you may or may not have, any kind of pancreatic disease or anything like that where it's working through your metabolic system through secretion. Even thyroid disease, you want to make sure that you're well aware of what's going on there hormonally. Because those beta 2 blockers definitely mask a great deal of the symptoms that come along with some of those items. And the reason is because most of those items, as your liver numbers increase, you have sympathetic responses. As your thyroid numbers increase, you have sympathetic responses. As your kidney filtration decreases, you have sympathetic responses. Yeah. And so you need those sort of panic moments, right? That those conditions cause to be able to diagnose that those conditions exist. Hypoglycemia being hidden by beta 2 blockers is one of the big deals. That's especially why when we're talking about sports performance, it's really not ideal, because you definitely can push past the point of no return and have a real problem there if you're not aware that you're already going hypoglycemic. If you're bonking already, then and you don't know it, right? Then you can really mess yourself up. So some of those considerations, you want to make sure that anything that a sympathetic response is part of the normative process for any disease or any condition that you have, that you are well aware of the state of that condition and it is either managed or you begin a management protocol before you go on any of those. It doesn't matter if you're using it just acutely for stage performance or for jitters in a non-athletic endeavor or a less athletic endeavor. You really want to make sure you're on top of that because it can do a couple things. It can mask those symptoms, and then if you have an emergency, it can mask those symptoms to the folks that are helping you through the emergency. Yeah, they're going to have a hard time treating you or getting you stable if you have a serious emergency, because they may not be able to figure out what's going on early enough, simply because the hormonal responses and vascular responses and cardiac responses in your body are not behaving normally. If you're severely hypoglycemic and you're going into sort of a reverse diabetic shock, then you essentially need to have a sympathetic response. Your heart rate should be through the roof in that case. And if it's like 75, they're going to have a hard time diagnosing that you need glucose right away. Away. You need that to get back to normal. And that could cause really serious issues if left undone. So just a few things to consider before you take them. The second thing to consider is in whatever profession that you're doing, right, that it's appropriate to be non-excitable. And so, for example, if you are part of a symphony orchestra, then yes, this could be an appropriate anxiolytic for that if you really want to use it. It's quite powerful for that. I'm not sure it's necessary, but it can be. If you're a stage actor, not so much, because you need to be excitable, and you need to not be deadpan, and you need to be able to have some athletic and sympathetic moments when you are acting in order to produce the kind of emotion that you'd like to on stage and present the character that you're trying to present. And so I don't really recommend it for that. And I would say anybody who's in a place where they're doing anything where there is need for that sort of explosive intensity of either intent or body, even for a moment, I would say this is too much, right? So those would be the considerations, at least for acute use.
Yeah, totally agree. Yeah, there was something that was brought up to us actually by one of the other coaches who's a medic, that he's seen issues with this where they have to treat someone differently for certain types of issues, including if you're like bleeding or something like that. If it's a significant bleed, there's normal vasoconstriction that occurs to reduce bleeding, to increase blood pressure if you have blood loss, so that you can stay awake, so you don't pass out, so you don't die. And you are blocking that response from occurring, which can have serious consequences. If and again, like you mentioned, some of the symptoms you should be experiencing, you may not be experiencing and not be able to communicate those symptoms, which means they might have difficulty treating you appropriately. And like the bleeding risk, though, is one that's significant, I think, and it's kind of similar to, it's a totally different mechanism of action, but it's kind of like if you're on what's the pain medication that they say that you used to say to take all the time, low dose?
Aspirin.
Aspirin, thank you. I was like, it's not Advil. Like aspirin, it's totally different mechanism of action, but the bleed risk is still there because you lose the ability to vasoconstrict as much. And so like it should be, getting into something like this should be something that's only necessary to keep you alive. And you should, because you have a significant risk factor. But I think we would all tend toward lifestyle interventions are going to be superior for most people and very effective. It's very, very rare that someone has to be on blood pressure medication for life. As condemning as it may sound, very few people need it, and it's a choice to remain on it in most cases. There are some people that we don't know how to get their blood pressure down without drugs, but most often there's a lifestyle intervention that's lacking that they can be put in place to handle this. And similar to what Amanda was saying earlier, if you're struggling with being in a sympathetic state all the time, anxiety, stuff like that, there are other ways to, it's like breath work can work. Also cold plunges, a cold plunge, like a real cold plunge, by the way, not getting in like 60-degree water for 1 minute, like actual, like has to be below 50 degrees. It needs to induce some degree of like mammalian dive response where you get that, where you feel like you almost like takes your breath away from you when you get in the water, and you need to be in it for 4 minutes or more typically to get this response. But you will experience a very significant parasympathetic response. Another honorable mention will just be sunlight exposure. When you're exposed to sunlight, that reddening of the skin that you get, not talking about a sunburn, but that pinkness that you tend to get in your skin, that flushing, that's actually nitric oxide being produced on the skin, and is very beneficial. It's useful, and it's what's also helping your body systemically regulate your blood pressure. Also, cold does the same thing. Cold exposure, not necessarily a cold plunge, but if you're just outside in the cold in the winter and your skin is exposed, that reddening of the skin, that is increased blood flow due to nitric oxide production. Sunlight does it, which specifically red light, by the way. So if you do red light therapy, as long as it's intense enough, that will work. And these do tend to have a parasympathetic response, so that, if you're dealing with something like anxiety, this can be useful. The other thing I would also bring up is green light therapy. You don't need the green light to be shining on you like with red light or like hitting your skin. You just need to be able to see green light. And it doesn't have to be like shining right in your face. It just needs to be around in the room or something like that. But it can promote a parasympathetic response. It can also promote, or I should say, reduce the experience of pain. Pain, is an experience. It's not a thing. It's not a physical thing. It's just something that we experience for various reasons, psychologically or otherwise. And that experience does vary from person to person, but it has been demonstrated that it can be reduced just from seeing green. This is part of why walking in a forest is calming. There's a lot of reasons why, but one of them is there's a lot of green light hitting your eyes. It just needs to hit your eyes and you'll get that response. So I think the final thing that I'd like to talk through is contrasting using a beta blocker for anti-anxiety versus an SSRI long term. What do we think would be pros and cons there, and maybe which one in general may sort of like come out on top?
Yeah, so beta blockers versus SSRIs is a really weird debate because one is better than the other, and I say that without any. I say that without any medical bias, right? Like the truth of the matter is that beta blockers can have physical side effects that we've talked about here, things that can be managed and monitored that are not outside of one's control. But what they do not do is they do not block nervous signals from the brain for normal neurological pathways for thought. And so SSRIs can definitely be anxiolytic. However, they also have the risk of being far more anxiety inducing in certain persons, depending on how they are received and the uptake in the body. How something is metabolized is outside of your control. You can't really do anything about that. And when it's a neurological metabolite, like an SSRI, you do have the potential for various kinds of mania, which is really bad news, right? Especially if you're staying on it long term. And so one of the biggest offenders, of course, we know is Xanax. And so, for example, I'm going to pick a propranolol over a Xanax any day of the week because a propranolol is not going to cause me suicidal ideation. It's not going to cause me any form of psychosis. It's not going to remove my internal locus of control. I will still have personal accountability for the things that I do, say, and think. And so the risks of an SSRI cannot be overstated when compared to something like a beta blocker. If that's the choice that you have to make, a beta blocker is what you pick up every day of the week because every physical condition that it may affect or mask can still be managed outside of the beta blocker itself. An SSRI, that's not possible.
Yeah, an SSRI essentially makes the brain more malleable. And so if you are taking an SSRI and then don't change anything about your lifestyle, you're even more so reiterating those patterns that got you to want the SSRI in the first place. So it's a really dangerous place to be because a lot of people will just take an SSRI like it's a cure-all, like it's going to fix everything, and not really use it as the tool that it was originally meant to be. Now we can get into whether it actually does what it says it does or not, but it does make the brain more malleable, and most people don't change their circumstances or the way that they're thinking, and so they just reinforce those patterns to basically never get off of this SSRI. So with since the beta blockers are mostly a physiological response, not necessarily a neurological response, or even really an emotional response. I mean, it's calming the nervous system a little bit. It's not really doing anything to you emotionally. So sure, you'll feel less worked up, but it's not really changing something in your brain.
Yeah, it's not playing on the dopamine serotonin balance and cortisol. Like it doesn't mess with that per se, at least not directly, and even downstream, any association seems pretty weak. And you're not going to tend toward being psychologically addicted to it like you can with an SSRI, because long-term SSRI use does seem to form dependency because you walk around with chronically high serotonin. And your brain sort of eventually gets used to this, especially the younger you start. Those of you that are even like, I suspect anyone under 25 because you don't have a fully formed prefrontal lobe. And I would even say like anyone should, in that age category, should do their best to stay off of these types of medications because your brain is still learning its environment. It's still learning and growing and changing in a more profound way before age 25. And generally would advise a lot of caution around using any medication, like this anyway, like an SSRI, but particularly when you're younger. And I definitely concur that a beta blocker for anti-anxiety purposes seems a lot easier to manage. When you come off, you're a lot less likely to have any sort of real dependency psychologically. An SSRI, one of the things that it's doing is reducing your experience of life. It's sort of like, turning the color down and making things more gray, not necessarily depressive manner, but just in a more passive manner. A beta blocker can have the effect of reducing your drive because you won't be as excitable. But as soon as you come off this, your environment seems to go back to normal. You're not messing with the dopaminergic system or anything like that. And the potential consequences that we're looking at that we want to manage from a beta blocker are a lot more manageable. You can monitor your glucose from home. You can monitor your blood pressure from home, make sure it doesn't get too low. There's all sorts of things you can do to make sure that it's managed. Whereas when you're talking about an SSRI, you can't measure these things really. And kind of like you mentioned before, there's a lot of things that they've been claimed to do over the years that have kind of been debunked. We're still kind of actually learning what SSRIs
You're breaking
do.
up again a little bit.
Okay, sorry. We're still learning exactly what SSRIs do. It's kind of an ongoing field of study, and a lot of the claims that were made originally just are not really holding up. So I definitely concur with that. And again, lifestyle's just going to be the superior way to manage these things with some of the interventions that we brought up before. And one thing I've noticed with a lot of people that are athletes, they're just not getting enough salt. Salt's been demonized when it comes to blood pressure and things like that. Some people are very sensitive to salt and need to keep intake down. As long as you're not one of those people, and that's most people, introduction of salt will actually help you manage blood pressure better. And high blood pressure can make you feel more sympathetic, can make you feel more irritable. And so even the introduction of salt can make you calmer, make you feel better. And this is simply because it's permitting the fluid that you have in your body to be managed better, because your body manages fluid by gradient shift, by positive and negative charges. And salt will allow your body to basically manage where water goes. And when it's unmanaged, it tends to collect in the gut. It tends to collect in places that your heart has to work harder to pump through and things like that. And it disallows the kidney also, if you're low on salt, if you're too low, it makes it so the kidney cannot manage or cannot purge, if you will, and create urine, because like you need a bunch of salt for that to happen. The liver, or the kidney, I mean, is this, as far as I know, the saltiest thing in your body. And that's because it's always attracting more water to itself. And that's fundamentally how it works.
Yeah. And I think the SSRI, to put a cap on that, right? The large issue with an SSRI is because it is a neurological block to a receptor. It has unknown effects with that mental malleability that Amanda was talking about. When you don't change environment, what they found is that negative radicalization of existing ideas becomes prominent. If you're suicidal, an SSRI is going to make you more suicidal. If you're angry, it's going to make you angrier. If you are watching YouTube videos that piss you off every day because you like rage bait, you're going to get more pissed off. And it sounds surprising because, what you've been told is, well, the SSRI will calm everything down. It will mute all that. But it only does so in a hormonal way. It doesn't actually stop you from thinking, right? You still think your own thoughts. Yeah. It's just that you do so in a way that's manic versus normal and normative. So, yeah.
The other thing SSRI will tend to do is make it so that the good moments in life, the happier moments, the positives, right, will not be magnified because you're not going to get the dopamine response that you need. And if you do, it's going to be blunted because the serotonin is so much higher, or at least your nervous system perceives it to be, so that like you're not going to get that reward response like you want to. When you receive good news, or when good things happen in life, it sort of grays a lot of things out and does, like you mentioned, sort of facilitate people to spiral into certain types of thought patterns that can be harmful. And it might make you feel more okay while you're doing it because of the serotonin, but it doesn't seem to really, at the end of the day, truly manage the condition in a very significant manner.
No, and it removes neurological urgency. Things that would shock you, thoughts or things that you have that would normally shock you, will no longer shock you. That's why it feels normative when you're on them.
Yeah.
And so, and especially, by the way, in a world full of neurodivergence, no matter the cause of that, whether it's environmental or whether it's toxicity of certain things or whether it's whatever, in a world full of autistic neurodivergence, being on an SSRI is extremely damaging to someone who is neurodivergent, because SSRI causes formative patterns in the brain that can be reinforced. And if you have a malformed formative response in your brain to social interactions or anything like that, an SSRI is going to further damage that and make it really hard for you to function.
Yeah, and interesting enough, for someone like that, if they really needed something, a beta blocker may be a better fit.
Yeah,
because it's going to just reduce the adrenal response from some of those social situations or other things like that. If they're in a crowded place and they normally have a very difficult time with that, it's going to reduce that sympathetic response and perhaps make it a little bit more manageable.
Yeah, agreed.
Maybe even help some of the sensory
the sensory issues.
Yes. Yeah, exactly. Yeah. You'll just be less sympathetic. And that's the struggle with people that are dealing with those conditions, is they get hyper sympathetic, particularly around like crowds of people and certain types of social situations and things like that. So it could potentially be efficacious for managing that stress, if you will.
Yeah. Reduces that overstimulation.
And an honorable mention, I guess, if we're talking about calming down the nerves, the nervous system, things like that, is have your magnesium levels checked.
Yeah.
There's some implications for the heart with magnesium and dosing it properly, of course, but having that checked, making sure that if you're deficient on magnesium, you're alleviating that can help a lot with the nerves or the tension that can creep up in situations.
Yeah. I think also, like, if you're dosing it correctly, ashwagandha is effective for short periods of time. I would not use it for long periods. It's hepatotoxic. And so I would never use it for a long period of time, but low dose ashwagandha, something like 600 milligrams a day, can be effective if you really need an acute help for anxiety in a certain situation.
Yeah. Yeah. Very good. Do you guys have anything else to add on the tail end of this?
I don't think so. I mean, just reiterating the breath work, and like, there's a reason Navy SEALs use breath work.
Yeah.
And not beta blockers. It does work. So emphasizing that in situations, trying to catch all the lifestyle factors basically that you can before getting on any kind of medication. And that's something that we will all preach day in and day out, is look at lifestyle first before we look to anything else. Yeah.
Yeah, totally agree. And if anyone would like help designing a lifestyle that supports your health and your well-being and your goals, whether they're athletic or lifestyle related, or just managing health conditions like high blood pressure or depression or things like that, let us know. You can find us at highcallingfitness.com. Book a meeting with us and have a little discussion, see if maybe it's a good fit and see how we can help you. And until next time, gains and grace, everyone. Thanks a lot.
Gains and grace.